Perfusion. Shock and DIC, NUR. Scope of the concept. Optimal perfusion, impaired perfusion, no perfusion. Body tissues receive adequate amounts of blood and oxygen carried on the hemoglobin. Body tissues are deprived of oxygen, ischemia. Body tissues do not receive enough blood flow to maintain the functions of the cells, and the cells die, necrosis. Review of concept, perfusion. Primary job of heart, to provide adequate blood supply to the body. Stroke volume, difference BTW and diastolic volume and end systolic volume, how much blood the heart ejects with each beat. Ranges from 60-100 milliliter beat. Sitting down you might only be 60. If you're walking around, running around, you might be closer to 100. Average, approx. 70 milliliter beat. Cardiac output, amount of blood the heart ejects within 1 minute, L-min. Average, approx. 48 L-min. CO equals SVXHR. Review of concept, perfusion. What affects cardiac output, grab. Contractility. Heart rate. Preload. Afterload. Heart rate go down, compensate in another way, contractility change, to make sure cardiac output numbers don't change. Patience is dry and preload is low, compensation increase heart rate. Patient it really clamp down and afterload is high, so it's hard for it to get out. You might see an increased heart rate, the heart might be working harder. Factors.
Preload.
Definition: the amount of cardiac muscle stretch that occurs at the end of diastole, just before the ventricles contract. It is related to ventricular filling. Components: influenced by venous return to the heart and compliance, ability to stretch of the ventricles. Alterations: decrease, hypovolemia, I.e. hemorrhage or third spacing of fluids, increase, sodium and water retention, I.e. renal disease and heart failure. Clients: vasoconstriction, ineffective contraction, overstretching of cardiac muscle. After load, the force the ventricles must overcome to eject their blood volume, the load, which the ventricles must push against. Right ventricle pumps into pulmonary arteries, left ventricle pumps into systemic circulation. Decrease, vasodilation or blood vessels vasodilate. Increase, pulmonary or arterial blood pressure, vasoconstriction. Increases workload of heart equals increased myocardial oxygen consumption. Contractility, the intrinsic capability of cardiac muscle fibers to shorten. Degree of stretch with cardiac muscle fibers. Think of rubber bands, old versus new ones. How do they stretch and bounce back into original length? Decrease, reduces cardiac output related to inability to force blood out of the ventricles. Increase, Too much contractility can put stress on the heart. Preload, remember, is the amount of stretch that occurs at the end of diastole, so it has to do with how much fluid is in the heart so that it can stretch to the myocardium. Manipulate preload. What would we do to increase preload greater than fluid? Patient fluid overloaded and we wanted to decrease preload greater than diuretic. Afterload isn't something that you really want to increase ever. It's just something that kind of happens when you're trying to increase blood pressure. So whenever you have vasoconstriction, it makes it harder for the heart to get the blood out of the left ventricle, which is what increases afterload. So anything that makes it harder for the blood to eject from the heart. That would be an increase after load. That would be an increase after load greater than vasodilator. That's gonna relax them the vessels, and then it's gonna be an easier target to get the blood out. That's gonna relax them the vessels, and then it's gonna be an easier target to get the blood out. Contractility is how hard the muscle is squeezing, so contractility a medication, milrinone, dobutylamine, dopamine to a certain extent. Perfusion across the lifespan. Infants, greater risk of heart failure because the immature heart is more sensitive to volume or pressure overload. You're probably not going to see a healthy baby, but someone who has congenital problems. Noted cyanosis while feeding or crying may have an abnormal shunting of blood between heart chambers, resulting in an increase of desaturated blood in the arterial circulation, sign of a heart problem. Congenital heart disease is the leading cause of death, excluding prematurity, during the first year of life. Children respond to severe hypoxemia with bradycardia as opposed to the adult response of tachycardia ***. Cardiac arrest in children generally results from prolonged hypoxemia related to respiratory failure or shock rather than from a primary cardiac insult, as in adults, like sudden infant death syndrome, SIDS, rather because they don't have the atherosclerosis that an adult will have sudden cardiac arrest. Review of concept, perfusion. Hemostasis, the process by which the body slows and stops itself from bleeding. Too little hemostasis equals hemorrhaging. Too much hemostasis equals unwanted clots. Three steps of hemostasis. Hemostasis, so he knows stasis, is when the body stops himself from bleeding out. Vasoconstriction happens because we don't want to send all of our blood to the hole in the body. Platelet plug formation over the hole. Coagulation cascade gets released